We're going to discuss trauma and reactions, common reactions to trauma today. So very briefly, last week we went over 3 different types of trauma: acute trauma, chronic trauma, and complex trauma. We also discussed kind of the definition of trauma, which is just any distressing event or experience to a person that makes it difficult for them to cope or function. So today we'll go ahead and move on. We're going to talk about number 1, re-experiencing the trauma. One thing could be, you experience nightmares, and that's because, your subconscious is still, thinking about the trauma and what happened to you. So there's nightmares, there's flashbacks, there's distressing thoughts and feelings about the trauma, emotional distress or physical responses, obviously, to reminders of the trauma. And again, that could be, from experienced by flashbacks and different triggers that remind you of that trauma. So when you do experience physical things, sometimes your heart might race, you might feel nauseous or dizzy, might even feel lightheaded, just different things happen. The next, number 2, is avoidance. I think we kind of know in order to avoid or suppress those memories, oftentimes people turn to drugs or alcohol. And again, even if it's for the moment, they are, you're able to relieve some of that trauma and some of that negativity that you're feeling. Also, people will avoid things like activities, people, places, or things that remind them of the trauma. Say you were in a car accident at a certain intersection, you may avoid that intersection and go around it if possible, things like that. You'll avoid going back to the place where maybe the trauma happened or things that remind you of that trauma. Also, you'll probably avoid conversations about that trauma. So if there's certain people maybe that always want to talk about it with you, you may, avoid them because you don't want to get into discussion about that. Number 3 is negative thoughts and feelings. So oftentimes people either blame themselves or there is external blame as well. You tend to lose interest in activities, sometimes because of the depression that follows after a trauma. You may have feelings of isolation or disconnect from your surroundings, difficult expressing positive feelings. And sometimes you actually have loss of memory related to the trauma. So, just oftentimes after a trauma, we have that negative lens on the world. So kind of always looking out like what next is going to happen to me, what bad is going to happen to me next. And that's just a normal reaction to trauma. And number 4 is hyperarousals. So, the feeling of always being on edge, becoming irritable, quick to anger, or even, being aggressive. And we find that oftentimes, I work in a couple hospitals where, you'll find people that have experienced trauma are very quick to anger. They always think you're out to get them. They always think you don't want to help them. They're very, they just escalate very quickly. So I've definitely seen that response. People they startle quickly, like they react to loud noises or door slamming or loud voices. That's another common reaction. Difficulty concentrating. Sometimes people are frequently scanning their environment, making sure that they're safe at all times or looking for exits. Difficulty sleeping is another huge common reaction to trauma. A lot of people have difficulty with sleeping. Feelings of anxiety and related symptoms such as the racing heart that we talked about, upset stomach. A lot of times you'll have people that have stomach aches or headaches, and those are very common reactions to trauma as well. Risky behaviors and sometimes overreacting, which again kind of leads me back to that being like overly aggressive or quick to anger. They just kind of overreact to things that are more minimal. So those are just a few, just the 4 areas that are common reactions to trauma. And next week, we're going to talk about what are the key signs and symptoms of trauma. And I look forward to meeting with you then.